Evening, everyone. Today, we are going to deal with the repertorial outlook of female infertility. In the last few sessions, we have already seen what is infertility, maybe a male infertility or a female infertility. We have seen their causes of etiological factors. We have seen their clinical features. We have seen their complications, and especially the homeopathic protocol. But today, we'll be solely seeing only the repertorial outlook. What are the rubrics to be taken in case of female infertility, and so on. Now, basically, we all know that different kind of patients come with different causes, and these different causes may be elicited in a way of different symptoms in each and every patient. So this is how the picture of infertility goes in our day-to-day practice. So it becomes very important for us to evaluate each of these symptoms and then go back to repertory and find the appropriate rubrics for this. So we'll continue. The objectives of this session will be how to derive the rubrics from the causes of female infertility, to understand the choice of a rubric, and compare the rubrics from different repertories. So before I go into the topic proper, we'll just have a quick glance about what a repertory is, the types of repertory, and what is repertorization. So repertory, basically, we collect all the symptoms which is there in the homeopathic Metri Medica. We arrange it systematically with a particular logic. So that is what is repertory. So a systematic and logically arranged index to the symptoms of homeopathic Metri Medica, which is full of information collected from toxicology, drug proving, and clinical experience. That is the definition as such. Now, when we talk about repertorization, we know that we have n number of symptoms in the homeopathic Metri Medica. But if we have to find out a particular remedy, it becomes very difficult for us because n number of remedies for one particular symptom. And how to narrow it down, that particular process is known as repertorization. So today, I'll be showing only few repertories. We'll just brush it up. So types of repertory, we know that repertory is having, or it is based on a particular kind of philosophy. Now, if it is a philosophy that is based on the generals to particulars, we have Kent, we have complete repertory, we have Murphy's repertory, we have synthesis repertory. But if it is from particulars to generals, then it will be BBCR, BTPP, and even synoptic key. If at all there is a repertory without any distinctive philosophy, we call it to be a concordance repertory. Under that, we have nurse and general. Then we have a clinical repertory, which is again divided, whole body, special parts, and even some clinical conditions. Now, whole body, we have particularly called as Boric's repertory and clinical repertory. We have specific parts. What we are going to deal with is Minton's repertory. We have a repertory on special conditions like that of Bell's diarrhea, Ellen's repertory of intermittent fever. Then we have card repertory. Card repertory, we have Kishore's card repertory. And then mechanically aided one, which is very well used. Radar is used, home patch, which is used every time. Okay, these are the types of repertory. Now, just a glance of repertory, that is repertory of the homeopathic Metri Medica. That is, it is written in an anatomical schema, that the whole chapters are anatomically. Then we have rubrics which are arranged alphabetically, and most of the chapters follow the STME pattern. There is a side, time, modality, and extension. Now, in basis of Kent's repertory, we can have one more repertory that is the complete repertory. It is a full version, full-blown version of Kent's repertory. So the arrangement, everything has been the same. Next one is the BBCR. Now, it is based on these kind of principles. There's a doctrine of complete symptom and concomitance, doctrine of pathological general, doctrine of position and time. I'm not going in deep to it because it is a known fact. Everyone knows all this. Just a brush up to the theory part. So clinical rubrics, evaluation of remedies, fever totality, and concordance. Next one is synthesis repertory. Synthesis, we all know that it is a printed version of Radar. It started like that. So it follows Kent's repertory, and any case which is rich in generals and characteristic particulars, you can use this repertory. It is very useful. Next is Murphy's repertory. In Murphy's repertory, everything is given alphabetically. And whatever pathological generals which you get or constitutions, maybe any clinical format, everything is in a clinical format in this. Diseases chapter, nerves, and all that. They are very rich in mentals, very rich in genders. Like every repertory, if it is combined together, we get Murphy's repertory. Next one, uterine therapeutic repertory. The one repertory which is very useful in case of female complaints, or we can say it is a one spot, treatment, or one spot place where you can go and find every female complaints. They always remember it doesn't have any philosophy. Clinical repertory, it's a clinical repertory based on special parts. Now it is divided into two. We have a Metria Medica part and repertory part. And both Metria Medica and the repertory part, again, it is divided. You can get symptoms accordingly. That is, first menstruation, one chapter will be there. Then before menstruation, during menstruation, after menstruation, then one chapter for amenorrhea, another chapter for metorrhagia, lochia, leukorrhea, concomitance, aggravation, and amelioration. These are the entire things which you can find in Minton's repertory. It is one of the best repertory for female complaints. Next one, Fatak's repertory, which has been used in our daily day practice. Pure alphabetical repertory, we find a lot of cross references in this particular repertory, and a lot many diagnostic terms you can find in this. We have clinical repertory by Clark. Now, this particular repertory, you can find all these sessions like clinical repertory as such, in which you'll find a lot many diagnostic conditions, then repertory of causation, then repertory of temperaments, dispositions, constitutions, and states, then repertory of clinical relationships, and repertory of natural relationships. So all these you can find it in our Clark's repertory. And finally, we have our William Borick, the Borick's repertory. We all know that at the end of the Borick, we have repertory part. So it's widely used bedside clinical repertory. Chapters follow Hahnemannian schema, and the rubrics are arranged alphabetically. And when you see, it is arranged under these kind of headings, that is cause, time, type, location, character of pain, concomitance, and modalities. It is arranged accordingly. There is one more repertory which is very useful. I find it very fascinating because every symptom which has been given without any change, without twisting and turning it, the symptoms are given as such in this particular repertory. That is Nurse repertory. We all know Nurse repertory is based on the Herring's guiding symptoms, and anatomical and regional divisions of the chapters are being given in this. So now we'll go into the topic proper, that is the rubrics and the female infertility. Before I start, I would like to say that many rubrics are same in every repertory. It's just that the representation is different. So I'll not keep on repeating each and every rubric. If you want, you can take a screenshot of it. We'll just go through. Okay, so now when we practice in our daily day-to-day life, we have to consider the etiological factors of the infertility, and that is from several sources. We need to find it out. Now, and talking about infertility as such, worldwide, if we take, the incidence rate becomes 15%. But in India, it will be 10 to 14% of all the Indian population. And that too, the higher rate is in urban areas. And we see that 1 in 6 couples are impacted. That is a recent survey which has been done. Now, when we go to the causes are widely recalled as the uterine causes, we have tubal factors, we have peritoneal causes, we have ovulatory dysfunction, we have cervical causes, infections in the lower genital tract, congenital defects of the genital tract, dyspareunia, and vaginal causes. Now, first one, we are going to highlight upon the ovarian factors. Under the ovarian factor, the most important condition that can lead to infertility is polycystic ovarian syndrome. And under polycystic ovarian syndrome, always remember, nearly around 70% of anovulation infertility is caused by polycystic ovarian syndrome. And the symptoms include anovulation, irregular menstruation, hyperandrogenism, which is clinically manifested by hirsutism, acne, androgenic alopecia, endocrine dysfunction like insulin resistance, obesity, and then we have acanthosis nigricans, type 2 diabetes mellitus, hyperprolactinemia, etc. Now, to talk about the menstrual pattern of PCOD, they have painful periods centered in the ovaries, prolonged and heavy bleeding with bright red blood and dark clots, all sort of either too short or too long or no menstrual pattern at all. This is what happens in polycystic ovarian syndrome. Now, why I'm going through the symptoms are because we need to find out the appropriate rubrics. That is why I'm mentioning the symptoms as such. So firstly, we will deal with the Ken's repertory. In Ken's repertory, we can go to the chapter female genitalia. This is basically upon the symptoms, taken from the symptoms. We have pathological as well as direct rubrics. We'll see it later. Now, female genitalia, depending upon the patient which comes to us and the patient which symptom they elicit, we can choose among the rubrics which are given under the rubric menses. The patient, if they come with menses absent, amenorrhea, you can take menses absent amenorrhea. If it is copious, if it is irregular, again, short duration. We have short duration for 1 hour. We have short duration for 1 day. And all that rubrics have been given under the Ken's repertory. Even menses protracted, menses bright red, menses clotted. Now, already we have mentioned that any kind of menstrual pattern the polycystic ovarian syndrome can have. So accordingly, the patient comes, they tell you the symptom, and we have to choose the rubric. So, and the one more thing which we need to see is the other conditions, that is obesity. Under the generals chapter, we can go and find out obesity. It's not been mentioned whether it's a male or a female, so we can just take it as a general symptom. Now, skin, this skin, whatever rubrics have been written, are basically either because of hirsutism or because of the acanthosis nigricans. So we know that acanthosis nigricans, the skin becomes a little brownish or blackish in color. Then we have the little thickness of the skin, and we have hirsutism. We have hair growth, the testicular hair growth, we can say, or the male pattern of hair growth. So under the skin, the rubrics are discoloration blackish, hard parchment-like, hair unusual parts on. I'm not talking about the remedies right now. We'll see it all together. Now, one direct rubric we can find in Ken's repertory is female tumors ovaries. And under ovaries, we have right, we have left, and then we have a cyst. Accordingly, you can choose. Even though I say it's a direct rubric, still I have found only one direct rubric in all the repertories, which we'll see later. But in Ken's repertory, if you want as such polycystic ovarian disease, you will not find it, but we can take it as a tumor in the ovaries. That is right, left, and the cyst. So similarly, in Murphy's repertory too, you can find under female chapter, you can see menses general, irregular, then amenorrhea, menses absent, ovaries general, cyst, genitalia, ovarian. The same way, skin, there is hair, skin, unusual parts on, hardness, parchment-like, hairy skin, women in, that you can take specifically. Then blackish discoloration of the skin. Obesity, under generals, we can find a particular rubric called obesity, general, uterine complaints with. This becomes the important one. The other one in Ken's repertory, we just saw obesity. But in Murphy's repertory, they have with uterine complaints. That becomes important. Then obesity, general, young people in. Same way, we go to Fartag's repertory. Same things have been given. If you see the rubric ovary in general, we have right, we have left, we have cystic, and here one another addition is swelled or enlarged. Now, why do we take swelled or enlarged? Is referring back to the pathology of the polycystic ovarian disease, wherein we have hypertrophy of the theca cells, thus stromal cell enlargement and all that. Because of that, the volume of the ovary increases. That's why we can take that particular rubric, ovaries, swelled, enlarged. So now, Minton's uterine therapeutics. Now, in under menstrual chapter, now I've already said there are a lot many chapters, menstruation, before, during, after, and all that. So under the chapter menstruation, under that, time and quantity of the menstrual discharge, again, we have all this. Irregular, late or too late, profuse and protracted. Protracted means long enough. Protracted, continuing too long, retarded or delaying. Then short of too short duration, and suppressed. There are many more. I've just taken which suits the PCOD. Then general concomitants. Under that, we can see skin unhealthy. Then amenorrhea, ovarian disease of. I had said that apart from menstruation chapter, there is one more chapter in maintenance uterine therapeutics, and that is amenorrhea. So under amenorrhea, if you go and check, there is ovarian disease of. This becomes very important for us to get a specific or a direct rubric. Now, ovary, right enlargement of, ovary right swelling of, we can say otherwise, then ovary left swelling of, then ovary swelling, both. When right and left is not being given, we consider it as bilateral. The next one, again, complete repertory. Under complete repertory, also you can find the similar rubrics. I don't think I should repeat the entire thing, but under this, again, we have female genitalia. Under that, go to the menses rubric, go to the pain rubric, you will find lot many symptoms. If you want, you can take a screenshot of this. And yeah, one particular rubric which you need to remember is skin hairy masculine in women. That itself shows hirsutism. This is an important rubric in complete repertory, which is a little different from the other repertories. Again, in complete repertory, generalities, if we go, we find obesity, women in, obesity, hormonal. Now, again, this is again important for us. Generalities, obesity, hormonal. So when a patient comes with PCOD, we analyze them, and then if you go for repertorization, we can take this particular rubrics. And again, female genitalia, menses, scanty, obesity with. These are the rubrics in complete repertory. The next one being some direct rubrics for PCOS. Now, talking about Boric's repertory, under the under female sexual system, you can find ovaries pain in the right ovary. Then female sexual system, again, I forgot to say, I think in Boric's, it's always divided into systems, respiratory system, circulatory system. The same way, female sexual system, ovaries, cyst, dropsy. Then Clark's repertory, if we go, it is clinical cyst and clinical ovaries cyst off. These are the two things which are given in the Clark's repertory. Synthesis repertory, I'll talk later. Then we'll go to the nurse repertory. Under nurse repertory, the chapter generalities, female ovaries affections. There is one particular rubric like that. You can take that. Then ovaries congestion, ovary swelling, ovaries tumors. These are important. Murphy's repertory, if we see, again, we have female cyst, genitalia, ovarian, which is left, again, right. These are the subrubrics which are given under the Murphy's repertory. Now, synthesis repertory, female genitalia, tumors, ovary cyst, again, right and the left. I had told that one particular repertory I found the most appropriate rubric for PCOD. That is under synthesis repertory. If you go to the chapter generalities, we find Steen-Leventhal syndrome. Steen-Leventhal syndrome is another name for polycystic ovarian syndrome. We all know. And there is only one remedy which has been given, that is corticotropinum. Now, this was about the PCOD. Now, what I have done is, whatever rubrics were there, I've collected the most important remedies from it. And we'll just go through what are the remedies. The common remedies which we found is sepia, pulsatilla, calciracarb, calicarb, thuja, natramure, epis, senecio, and sickle cord. Now, in sepia, always remember that the menstrual pattern is late and scanty, ovaries which are enlarged with fluid-filled cyst, and abnormal hair growth on the face, upper lips. These are the patterns of PCOD which is connected with the sepia. In pulsatilla, suppressed menstrual pattern for a longer duration. Now, calciracarb, if you are talking about, for profuse and prolonged periods. So I'm telling only the pointers of it and not including the mental symptoms. But whenever the patient comes, we have to analyze the patient as a whole, not just one rubric. So, calciracarb for profuse and prolonged periods, the natramure for PCOD with irregular and suppressed menstrual cycle. Thuja is for retarded menstrual flow with multiple cysts in the ovaries. It actually has an ability to dissolve the growth and accumulations which is found anywhere in the body. So that means it will be having a supreme power to dissolve the cyst. And treatment of the extreme hair growth on unusual parts, we can give thuja. Thalicar, suppressed menstrual pattern for several months. Finitio, one important remedy, which will be having all the symptoms which comes, just before the menstruation. But the only thing is that the flow will be absent, like heaviness or pain in the pelvic region will be there, nausea will be there, but here the flow is absent in the patient. Fecal cord, menstruation too profuse or too long in duration, then menstruation like flooding with violent cramps will be there, and tingling in the limbs and great weakness. And in fecal cord, we find a particular symptom that is suppression of menses in thin, scrawny married women. That is all the thin, unhealthy looking, body with married women. Apart from that, I spoke about corticotropinum, which is the only remedy which is given under the Steen-Leventhal syndrome. The symptom of corticotropinum goes as menses absent, irregular, masculization of females, and hair distribution. This is an important symptom of corticotropinum. Apart from that, we have apis mellifica. We have short duration menses, 1 day only, then appears at interval. And other key pointers which are given are right ovary if it is affected. We can think about lycopodium, belladonna, and apis. If it is left ovary affection, think about thuja, lachesis, argentum metallicum, ustilago, and zincum. Short menstrual pattern, it is sulfur and pulsatilla. If it is 1 hour, it is euphrasia and sorinum. Just few hours, it is viburnum. Now, telling about the acanthosis nigricans, the remedies which I got were borax, calcarea car, graphitis, hepasul, silesia, staphy, and sulfur. So this was about the polycystic ovarian disease. The next one, which is important in the ovulatory dysfunctions, are premature ovarian failure, the ovarian insufficiency syndrome. Now, we all know that in the premature ovarian failure, there is a loss of ovaries before the age of 40. FSH and the ovary, they did not actually work together after the age of 40. So, here there won't be any ovulation that is going to take place. I have found only 3 repertories which give the particular rubric. That is one Fartok's repertory, one complete repertory, and the Murphy's repertory. Under the Fartok's repertory and complete repertory, you can get the direct rubric, that is insufficiency of ovaries or ovaries insufficiency of, and there is only one remedy given, and that is lecithin. And if you go back to Borix Metra Medica and search the lecithin, you will find that there is ovarian insufficiency which is written. And in Murphy's repertory, apart from lecithin, there is one more remedy which is given as sepia. So, if a lady comes with premature ovarian failure, we have Fartok's repertory, ovaries insufficiency of, complete repertory, female genitalia insufficiency of ovaries, and Murphy's repertory, female insufficiency of ovaries. And 2 remedies which are important are sepia and lecithin. The next one, emotional stress. We all know that in a female's life, stress factor is very important. So, and the correlation between this emotional stress and infertility, the investigations were going on for long, many years. Researchers were being done. And what they actually found out was the biological interaction between this particular stress factor and infertility is due to the action of this, whatever stress hormones that we have at a brain level, and that too, especially on the hypothalamus pituitary, as well as on the female reproductive organs. So if this occurs, it will directly go and affect the hypothalamo-pituitary ovarian axis, then causing tubal spasms. And indirectly, what will happen? We have vaginismus, we have dyspareunia and frigidity. Now, this is what happens. And if we get this vaginismus or dyspareunia or frigidity, ultimately, one or the other way, there is a difficulty in conceiving. Now, we'll see a little rubrics on stress. I've just taken very few. Synthesis 9.1, that is mind chapter. We go to stressed anger. We have ailments from care, worries, excitement mostly, mental excitement, ailments from excitement, emotional, restlessness, tension, mental, fastidious, stressed only when. In Ken's repertory also, you can see stressed, affected by strain, pressure, or force. BTPB, if you go, we have mind, emotional excitements, effects of. These are few rubrics which are based on the stress. Now, what we have to deal with, again, we have complete repertory, in which the mind chapter, if we go, we can see that rubric is there, cannot handle things anymore actually by stress. Again, in housewives, then again we have excitement, excitable, ailments from aggravation, mental and emotional consequences of. Now, these are the few rubrics. Finally, we have vaginismus. We all know that it's a psychogenically mediated involuntary spasm of the vaginal muscles. And finally, it results in the inability of having a penetrative sexual intercourse. Now, the rubrics are, first from the Kent's repertory, we have genitalia female. Under that, we have direct rubrics like vaginismus. Vaginismus coitus preventing. Vaginismus coitus during. Then we have pain, contraction, vagina, coitus during. Now, this particular rubric, that is vaginismus coitus during, will be more indicated to dyspareunia than to vaginismus actually. Then constriction, vagina, touch, aggravation. Then, if you go to the chapter, mind chapter, because already I mentioned it's a psychogenical one. So, fear, caution, and a thought of in a woman. Not only under the under the rubric fear, it has already also been given under the rubric anxiety. So either go to general genitalia female and go for a direct rubric that is vaginismus, or go to the mind chapter and get the rubric. We have nurse repertory, many symptoms about vaginismus. So vagina, pain, caution during, cannot bear examination. There is a peculiar symptom of vaginismus. Then constriction, caution preventing, heaviness, vaginismus with, inflammation, vaginismus with, sensitive, tender to touch, then soreness, painful at the entrance during caution, vaginismus caution during again, vaginismus spasmodic constriction from least touch gradually goes upwards, intense soreness, then with uterine irritation. What I mean to say is, in case of nurse repertory, you'll get much more symptoms, much more choice of rubrics you will get in nurse repertory. Now, caution, sensitiveness, even vaginismus, mind, fearful, caution at the thought of. So this is what you get in nurse repertory. Same as in case of complete repertory. Complete repertory, there is one separate symptom, that is a rubric female genitalia, leukorrhea, vaginismus in. Now, this is a little different from the other repertory. Female genitalia, leukorrhea, vaginismus in. Now go to synthesis 9.1, you'll find anxiety, caution, thought of from women, anxiety in. Then again, vaginismus caution during, painful, preventing, sensitiveness. So one and the same rubrics, it's just that it has been represented a little differently in different repertories. The speciality of synthesis 9.1 in case of vaginismus is under the chapter generals, go to the constriction. Constriction, internally spasm of sphincter of orifices. It basically spoke of vaginal muscle spasms, right? So constriction, internally spasm of a sphincter of orifices. A different rubric apart from others. Then Clark's repertory and Fartuk as well as Boric, again you get direct rubric of vaginismus. Clark repertory, it is vagina spasm of, under the clinical chapter, go and find out vaginismus. Fartuk's repertory, you'll get vagina spasms. Then Boric's repertory, again vagina sensitiveness, under bracket it is written vaginismus. Murphy's repertory, again same. Diseases, vaginismus, vagina, then sex during, a subrubric of it. Then go to the chapter female, we'll have vaginismus, vagina, painful during sex, preventing sex. These are the particular rubrics you'll find under Murphy's repertory. Next one, Minton's therapeutics. Here, it's not a little different. The same thing which has been given, that is vagina, sensitiveness of prevention coercion. Now, this is what given in Minton's therapeutics. Now, you included the Genry's repertory also. In case of Genry's repertory, we have one particular rubric. This is the second one, vaginismus with uterine in nervous, excitable, hysterical females. This is a little different one. So, vaginismus with uterine in nervous, excitable, hysterical females. The common remedies which I found after all these, referring all these rubrics in different repertories are sepia. First one, it's because of for vaginismus with painful sex, then tenderness of sexual parts to touch. This is a symptom of vaginismus in sepia. If it is natramure, it is given for vaginismus with burning sensation in the vagina, burning sensation in the vagina, and smarting sensation in the vagina. These are the two symptoms, whose important symptoms which relates to natramure and vaginismus. Then we have ignatia. Ignatia is referred for vaginismus with sore pain in the vagina during intercourse, and vagina and vulva can be inflamed. Next is cantharus. Cantharus is given for involuntary vaginal muscle spasm and irritation of the vulva. And in this, the genitals are usually oversensitive. Cactus is a very marked remedy for vaginismus. And cactus is itself, the keynote is constriction. So for marked constriction of the vagina, we think about cactus. Silesia for vaginismus with tenderness of vagina. Then sensation of weight or pressure in the vagina. And that time we think about silesia. Talk about ferrum first. Again, vaginismus with inability to bear pelvic examination. That is ferrum first. Hemamelis, vaginismus with intense soreness. And gelsemium, it is basically related to the nervousness and the vaginismus. So vaginismus related to nervousness, we think about gelsemium. So this was about the vaginismus. Next one, important one is dyspareunia. Now talking about dyspareunia, we all know it's a term for the recurring pain in the genital area or within the pelvis during the sexual intercourse. The pain can be either sharp or intense, and it can occur before, during, or even after the sexual intercourse. Talking about the rubrics, there are again many rubrics. For example, I'll tell you, genitalia, female pain, aching, uterus coercion during. In the same way, if you check, there are genitalia, female pain, aching, uterus coercion after. There are rubrics like that. I've not written everything, but remember, if there is a rubric during, there is a rubric after too. So genitalia, female pain, aching, uterus coercion during. Again, burning pain, vagina coercion during. Pain, uterus coercion during. Pain, vagina coercion during. Sore uterus coercion during. Cutting uterus coercion during. There's every detailed symptom you will find in it. Any description, all the different descriptions you have in all this, you will find. So I've taken uterus, vagina, then ovaries. These are few rubrics in Ken's repertory, which are important, which will indicate dyspareunia. You can see pulsating coercion after. The rubric which you are going to choose should be solely depending upon the symptoms which the patient elicit. Just because you have written here, we should not be taking it. The next one is BBCR. Under the chapter sexual impulse phenomena, you will go to coercion painful. And then sexual impulse, concomitants after coercion, genitalia burning pains. Same way, corroding pains will be there. And if you go to the conditions of aggravation, amelioration in general, phenomena, coercion during aggravation. That also you can take. Nurse repertory again, the same things which we saw in Ken's repertory, but here coercion during aching on, pressing or touching of uteri, then coercion during cutting in parts, coercion during pain from dryness of vagina, then coercion during pain from soreness. So these are the rubrics which are given in nurse repertory. Again, you can see that there is a rubric in nurse, the first one, the female sexual organs, coercion during, pain with, almost constant desire, especially when she has white of egg discharge amounting to a furor utrinus. That is what is given in nurse repertory, and only one remedy is given, that is hybrastus. So others are same. Last rubric, you can see that female sexual organs, vagina, soreness, painful, and raw during coition. So unlimited rubrics have been given in all this repertory. It's up to us how we manage to make use of it. So Minton's uterine therapeutics, vagina burning after coition, vagina burning pain during coition, and sexual desire, coition, painful. These are the few rubrics which we can get in Minton's uterine therapeutics. Pathak's repertory, again, the representation is again the same. Vagina burning coition after, vagina cutting coition during, and female coition aggravation. Clark's repertory, as such, we get dyspareunia. The term dyspareunia is available in Clark's repertory. So clinical chapter you go and find out dyspareunia. Again, we have clinical dyspareunia, newly married women in. We have only one remedy for that, and that is tachycyclia. Synthesis repertory, if you go under the chapter female genitalia, you'll get coition, painful. The most common remedies are, first one is sepia, we'll talk about. In sepia, the dyspareunia is usually due to the dryness of vagina, and vagina is extremely tender. The natrum if it is, the painful intercourse from dryness of vagina again, burning and smarting are felt in the vagina during coition along with pain. Vagina is sore and itchy in nature, and usually the patient will be having aversion to sexual intercourse. Then we have platina for painful intercourse for sensitivity and vaginismus. Next is argentum nitricum. It is also very important for dyspareunia. But remember that the symptoms of dyspareunia will be definitely there. But after that, after the pain gets over, we have a vaginal bleeding. So for pain followed by vaginal bleeding, argentum nitricum is very well indicated. Staphycyclia, it is again for painful sexual intercourse from sensitive genitals. And that too in early days of married life. We have already seen the rubric like that. So creosotum for pain, burning in the vagina during intercourse followed by bleeding again. So we have two remedies as such, creosotum and argentum nitricum. Then we have ignatia for managing sore pain in the vagina during intercourse. Ignatia is very helpful. And we have a heated kind of sensation in the vagina. Lycopodium can be given to patients when they come up with burning in the vagina during coition. And plus, we have vaginal dryness along with. Then mercurius, uterine sensitiveness, vagina is sensitive, and it will render, because of this sensitiveness, it will have a coition which is painful. Next is sulfur, burning pain will be there in the vagina, coition, and sore vagina during coition. These are the few rubrics which we can get under sulfur, which is similar to that of the dyspareunia. If we talk about ferrum phos, it is pain in the uterus, coition during, and pain during coition due to, again, dryness. Talking about pulsatilla, it should be given to patients with sore uterus, coition during, and like a cutting kind of pain will be there during coition. Important remedy is lysinum. Uterine sensitiveness, vagina sensitiveness, and again, this will render coition painful. This is one important remedy which has been given. Then thuja, sore vagina during coition and burning ovaries after coition. Again, we didn't talk about the ovaries as such, but in case of thuja, we have burning ovaries after coition. So this is about the dyspareunia. Talking about frigidity. Now, frigidity, when we talk about, it is basically a failure of a female to respond to a sexual intercourse. Or in another way, we can tell it as an aversion on the part of a woman to sexual intercourse. Now, if you're talking about that, we have few rubrics. Either we can go to the mind chapter or even in the genitalia. We'll find Kent's chapter, Kent's repertory, if you're searching. Under the chapter genitalia female, you'll get coition, orgasm, wanting. Then coition, aversion to. In Fartak's repertory, as such, we have the rubric frigidity. Even in synthesis repertory, if you go, you find frigidity. Okay, so Fartak's repertory female chapter, you go sexual frigidity. Synthesis repertory, chapter female, go to frigidity, that is in bracket, it is given. Coition aversion, that means it is given as a cross reference. You can go back to the mind chapter and then see coition aversion, then sexual desire wanting, then can go to mind chapter and find out amativeness, want women in. Then talk about BBCR repertory, in which you get sexual impulse phenomena, coition aversion to. Then under Minton's repertory, you can search sexual desire, coition aversion to. These are the few rubrics which you can see. And in all this, the two most important remedies which we'll talk about is bromine and caladium. These two are very important for frigidity. So female sexual organs under Kent's repertory, Nurse repertory, if you go, you'll find coition aversion, then sexual excitement, desire, coition aversion. So these are one and the same actually. So these are the representation of the rubrics of frigidity in different repertories. Now, the most important one is the tubal and peritoneal factors. Now, before I go to the pelvic inflammatory diseases as such, we should always remember this particular tubal factors, these include the unilateral or the bilateral tuber blockage, or we can say loss of tubal functions. And this is due to ciliary damage. First of all, in case of a genital tuberculosis, then perisalpingitis. And if these two occurs, we have, basically we have adhesions and even tubo-ovarian mass formation will be there. And unilateral or bilateral hydrosalpinx with or without, obstruction. And when all this comes together, this affects the fertilization and the embryonic implantation. That is why the tubal factors or the peritoneal factors affect us. The first one we're going to deal with is the pelvic inflammatory diseases. And remember, whether it be a primary infertility or a secondary infertility, pelvic inflammatory disease causes around some 3.1 or 16.7 percentage. That's the incidence part of pelvic inflammatory disease and that of the infertility. Now, what will happen is the reproductive tract infections that occur are the main cause of fallopian tube adhesions. And talking about infections, we all know that pelvic inflammatory disease is basically, we talk about as a spectrum of infection and inflammation of the upper genital tract or upper genital organs. It may even include the endometrium, it may include the fallopian tubes, ovaries, pelvic, peritoneum, and other surrounding structures nearby. So basically, genital infections occurs, the tubes, the endometrial mucosa, most important ones. So we'll see the few symptoms if the lady comes up with is irregular and excessive vaginal bleeding, abnormal vaginal bleeding, copious and purulent, then nausea and vomiting, dyspareunia. I'll not talk about the rubrics of dyspareunia, which we have already dealt with before. Then we have pain and discomfort in the right hypochondrium, dull lower abdomen pain, pelvic pain. Now, to find out a pelvic inflammatory disease rubric, it becomes a little difficult. It is available for sure, but what we are going to do is first see the symptoms. So in case of Kent's repertory, if we go, we do not have a direct rubric of pelvic inflammatory disease as such, but we can go to the chapter abdomen. We can see pain, aching, dull pain. It's written see, boring, gnawing, etc. So this is a cross reference again, but it suits with the dull lower abdomen pain in case of pelvic inflammatory diseases. We have pain, aching, dull, hypochondria, right. If you go back and see the symptoms of pelvic inflammatory diseases, it is given pain and discomfort in the right hypochondrium. Now, why right hypochondrium? Because the liver might be affected. Okay. Genitalia female, menses copious, leukorrhea purulent, leukorrhea copious, menses irregular. Basically, we are converting the symptoms which we have got into rubrics. Complete repertory, if you go, we have apart from the dull aching pain and the hypochondriac pain in the abdomen, we can see genitalia, excrescence, bleeding uterus, again menses irregular, menses profuse. Go to the Fartak's repertory, you'll get rubrics like Again, it's one and the same in actually. Menses, copious, profuse, excessive. Then abdomen, pain, indefinite, dull aching. Leukorrhea, purulent. Leukorrhea, copious. And liver, including the right hypochondrium, that is enlarged, swelled. It matches along with the right hypochondriac abdomen pain. And that too, pain, anger after. Even in case of Boric's repertory, you'll get similar kind of rubrics. I'm not going to repeat again. It'll go a little boring. Next one, direct rubric. I've said it is little difficult, but not impossible to find a direct rubric for pelvic inflammatory disease. So if you go to the synthesis repertory, under the chapter female genitalia sex, there is pelvic inflammatory disease. And there is only one remedy which is given, that is sepia. So remember, synthesis repertory, pelvic inflammatory disease. And then go to the complete repertory. Under the chapter female genitalia, we'll go to the inflammation. Under inflammation, we have uterus, metritis. We have ovaries, ovaritis. We have tubes, fallopian, salpingitis. We have ovaries, ovaritis with peritoneal involvement with. We have already said, right, the pelvic peritoneum will be involved in case of PID. So these are the few rubrics which are definite, which you can take. The other, Kent, inflammation uterus, it's a broad one. Again, genitalia female, inflammation ovaries, right and left. Again, it's a broad and a general one. Boric's repertory, we'll find under the chapter female sexual system. We'll go to the uterus, inflammation, endometritis, metritis, again, chronic. We have acute also in that, but female sexual system, ovaries, inflammation, ovaritis, acute, ovaries, inflammation, ovaritis, acute peritoneal involvement, the same thing which we saw in case of complete repertory. So female sexual system, tubes, fallopian, inflammation, salpingitis. So basically everything is same only. So Murphy's repertory, if you go again, we find female, under chapter female, go to the pelvic inflammatory disease. Then under that, we go to the uterus. We have chronic, we have congestion with arterial, we have perimetritis and parametritis, and sexual excess after. This becomes the causation factor of PID. So accordingly, we have to choose the rubric. Now, based on causation as such, we'll get the rubrics. That is female genitalia inflammation. Mainly there is a mind symptom in here. So female genitalia inflammation uterus, emotional excitement from only one remedy again, hyoscyamus. If it is female genitalia inflammation of the uterus, after anger, it is chamomilla. Inflammation of the uterus after hemorrhage, China. After or from indignation, it is colocynth. The inflammation of the uterus because of joy and excessive joy, then talk about is cophia. Then we have inflammation of the uterus after labor, that is Naxomica. So based on the causation, we can pick up the little rubrics. The common remedies which we can talk about in case of PID are sepia, in which sepia should be given to a patient with pelvic inflammatory disease if the pain in the lower abdomen will be there and the pelvic area. And the most important one is bearing down sensation in the pelvis, burning or gripping in the uterus should be there, vaginal discharge of yellowish or greenish offensive discharge. The vaginal discharge will be usually yellowish or greenish in nature. Talking about Merck it should be indicated in the patients with PID with acrid, excoriating, and itchy discharges that cause a burning sensation in the vagina. And the discharges may be again purulent, yellow, or green in color. Talk about phosphorus, that is PID with bleeding from the uterus between the periods. Between intermenstrual period, that is phosphorus. Again, weakness usually follows the menstrual bleeding. Then left-sided ovarian pain during the menstrual pattern, and leukorrhea of white or watery mucus. That is what is phosphorus given for. We have sabina, that is PID with profuse and gushing bleeding. Bleeding is bright red and dark clots. Blood may have offensive odor. And pain is, in case of sabina, we can find actually the pain in the sacral back and that extending to the pubis. peculiar kind of symptom. Then in case of Medorrhea, we'll be having an excruciating pain in the pelvic area along with ovarian pains. And the emulation factor is pressure. Bleeding which will be there, will be very copious in nature, dark and offensive. Vaginal discharge of accurate nature and a fish-like odor. So fish-like odor in case of Medorrhea. Creosotum, which is given for PID with pain during intercourse, burning will be there in the genitalia and is felt along with the pain. And offensive, itching, corrosive leukorrhea. That is what we think about of creosotum. Epismelfica, usually we know that epismelfica usually produce a lot of inflammation effusion. And that is why we'll be having a symptom of burning and stinking pain in the ovaries. So PID along with this particular symptom, we can think about as epis. Arsenic album, we can think when we have burning pain in the ovarian region and kind of stitching pain in the ovary, which is into the thighs. And the thighs and all will feel very numb in case of ourselves. Belladonna, inflammation of ovaries causing violent pain in the genitals. Leukorrhea, which will be there. Along with that, there will be colicky pain. Cantharis is again one important remedy. You can think about cantharis when there is an inflammation which is violently acute, and smarting or burning pain will be there. Can be given to people who are nymphomaniac. Then cutting and burning pain will be there in the ovaries. A remedy which can be given sure shot for ovaritis and leukorrhea with sexual excitement. That is cantharis. Lachesis, we all know, it is basically a left-sided affection. So left-sided ovarian affection, and ovaries will be swollen, it will be indurated, painful, and uterine and ovarian pains are always better after the menstrual flow. Case of lycopodia, right ovarian affection with ovarian tumors. Pulsatilla is given when the leukorrhea is milky thick like cream with pain in the back. Violent sore aching pains in the ovaries. And lastly, we have Sickle cord, which acts on the muscles and the blood vessels actually of the uterus. And because of that, there will be much of hemorrhage. And the hemorrhage which occurs will be dark and fetid menses. And they'll be having a brownish offensive leukorrhea. And it is indicated for gangrene of female organs. So this is about the PID. The next one being the genital tuberculosis. Now we all know when there is a genital TB, it will usually affect the endometrial receptivity, leading to the defective endometrial markers. And what will happen? The vascularization of the endometrium and all, no, it will be it will become defective, and there will be endometrial atrophy and the syncytial formation and all that. That means adhesion formations and all will be there. So basically, what will happen in case of a genital tuberculosis? This T helper 1 cells, the response usually that leads to the implantation failure instead of the helper T2 cells. So we'll leave all that and go back to the symptoms. So genital tuberculosis is basically what will happen. The symptoms as such are weakness, low-grade fever, anorexia, anemia. Then we have menorrhagia, we have pelvic congestion, we have secondary amenorrhea, chronic pelvic pain, and postcoital bleeding. These are the few symptoms of genital tuberculosis. We'll see the rubrics. The rubrics, if you see, there are a few direct rubrics. The complete repertory, go to the chapter clinical, and you will find the rubric tuberculosis as such. This tuberculosis is not meant for female genitalia only. It is a generalized one. Maybe pulmonary, maybe a female genitalia, anything you can take that particular rubric. That is complete repertory, chapter clinical, go to tuberculosis. Then, sorry, complete repertory, female genitalia, tuberculosis again. Then complete repertory, female genitalia, menses, profuse tuberculosis in. Now comes the symptoms in case of tuberculosis. Same way, hemorrhage, uterine metrorrhagia, tuberculosis in. Complete repertory, there is female genitalia, tuberculosis, tubes, fallopian tubes. Then we have tuberculosis in the case of ovaries. In Fartak's repertory, if you go, you can find rubric menses, disturbances of, tuberculosis in. So these are a little rubrics in case of genital tuberculosis. Now, when we talk about that, there is Argentum metallicum, which is being given for genital tuberculosis of fallopian tubes. Talking about genital tuberculosis of ovaries, there is Psychocus bacillus. Then, talking about iodum. Iodum is basically given for leukorrhea yellow or yellowish color leukorrhea in tuberculosis in women, and they'll be having a thin, watery leukorrhea. Then we can think about millifolium and phosphorus for uterine hemorrhages tuberculosis in. So basically, these symptoms, if you go and check, if the patient who is coming to you, if they are having these particular symptoms, if you can go and check, you will get these kind of remedies. Solidago and Ustilago for disturbance of menstrual pattern, then lobelia, lycopodium, finitio for menses suppressed. That too in case of tuberculosis. So most important one, pelvic endometriosis. I know pelvic endometriosis everyone will be knowing because it was been taken in the last session. We'll just brush it up and go through the symptoms and the rubrics. Now talking about pelvic endometriosis, you know that endometriosis is basically defined as the endometrial-like tissue which grows outside the uterus, which induces a chronic inflammatory reaction. And even the scar tissues will be formed, adhesions will be formed. And now this adhesions or scar tissue which are formed may usually distort women's pelvic anatomy. Now, always we should go back to the recent researches which have been done. And the recent study also suggests that the uterine implantation gets affected due to the change in the endometrial receptivity in case of pelvic endometriosis. Now, talking about the symptoms of pelvic endometriosis are back pain during menstrual cycle. That is, last class, if you remember, Dr. Geeta had already said, if it is a uterosacral ligament involvement, we have back pain during menstrual cycle. Then we have congestive dysmenorrhea. We have heavy or irregular period, that is bleeding. Menorrhagia we have. Then pelvic pain, dyspareunia, dyshexia. That is often there is a alternating of diarrhea and constipation in case of endometriosis. Inguinal pain. We have pain on micturition and pain during exercise. Now let's see whether we get these kind of symptoms we can convert into a rubric or not. Under Kent's repertory, there is back pain menses during. A simple version. Back pain, aching lumbar region menses during. Then we can talk about pelvic pain. Then abdomen pain, cramping, gripping, hypogastrium menses. Abdomen pain, cramping, gripping, hypogastrium menses during. Then abdomen pain, aching, dull, exercise from. Again, aching, dull pain, inguinal region. Basically, these are the few rubrics which we can find. There are many more. According to what the patient comes and tells, you have to search. So genitalia female, menses vicarious menstruation, apart from the uterus. So we can take it. So nurse repertory, again, similar kind of rubrics we can find. Like menses during back aching, then menses during abdomen cramps, menses during pain, that is colic, dysmenorrhea, cramps at the beginning of the menstrual cycle, and cramps at the beginning, as if abdomen would burst. The remedy is nitric acid. So again, cramps, dysmenorrhea in. There are all the kind of representation of the rubrics have been given. So if you see again, uterus, cramps, painful during menses which are profuse, menorrhagia, menses irregular, profuse, menses during inguinal region, pain will be there in the inguinal region. Then menses, or during menses, pain will be there in the inguinal region. There is only one remedy, that is xanthoxylum. And urinary organs during urination, pain. If you go to the complete repertory, there is a rubric as such, endometriosis, female genitalia, endometriosis. And other rubrics which we can actually think about when we see the symptoms are exercise after, abdomen, pain, inguinal region. No, there are the other same, other same symptoms which are converted into the rubrics. One rubric you can see, rectum, constipation alternating with diarrhea. This is an important rubric. You can see another infarct, pain, neuralgia in general, cramps, gripping, colic, menses with. We have MAC-mu for that. Others are same. Now in synthesis and Murphy's repertory, you can get a direct rubric called endometriosis. In case of synthesis, female genitalia chapter, endometriosis, there is only one single remedy, and that is xanthosylum. Murphy's repertory, if you go, we have disease chapter in which you can find endometriosis chronic, and then you have a female chapter, endometriosis chronic. The remedies which are given in both of these separate rubrics are one and the same. Now, going into the common remedies which we can think is xanthosylum, the most important one. I will not be dealing with many rubrics, many remedies in this because it's been already told in the last session. Xanthosylum is very important with painful dysmenorrhea, excruciating pain in the pelvis, back and thighs and legs. So there will be excruciating pain in the pelvic region. There will be excruciating pain in the back, thighs, as well as the leg. Whenever endometriosis comes along with pain during the periods and severe bearing down pain in the lower abdomen, we have to think about simcifica. That is, severe bearing down pain will be there in the lower abdomen, or maybe even in the uterine region and even the lower back during menstrual cycle. Sabina can be given for patients who come with endometriosis with pelvic pain. And this particular pelvic pain will be colicky in nature, or you can say labor-like pain. Pain will be there in the small of the back from the sacrum to the pubis. I think I've told the symptom beforehand. Sepia, endometriosis with gripping, stitching, clutching pains in the pelvis, accompanied by urinary urgency will be there, and frequency. Pain while urinating and burning during urination. This is an important one in case of sepia. Pulsatilla, pelvic pain during periods. It will be always chills along with it, and restless and tossing in the bed will be there in the patient with pulsatilla. Naxomica, rectal pain during menstrual cycle, ineffectual urging for stool is available in Naxomica. Ammonium mure and lachesis is actually a little similar, which is related as endometriosis with bleeding per rectum during menstruation. Bleeding rectum during menstruation, ammonium mure and lachesis can be thought of. Natural mure, that is bleeding from urinary bladder, appears simultaneously with menses. So this was about endometriosis. As, already there were a lot many remedies which Dr. Geeta had already discussed. I'm not going into it. Next one is adenomyosis. Now, even adenomyosis has been discussed, but I'll just brush it up. That is, menorrhagia is there. We have dysmenorrhea colicky in nature, dyspareunia, frequency of urination, hypogastric mass. Now, I would like to say that there were recent studies which were done in adenomyosis, and these studies, they have actually demonstrated that with adenomyosis, there will be some kind of hyperplastic muscular tissue that can cause increased intrauterine pressure. And because of this, there will be dysfunctional uterine hyperperistalsis. Now, finally, what will happen is if there is a uterine hyperperistalsis more, and if there is a intrauterine pressure which is more, they trigger the abnormal inflammatory responses. And that is why we have all these kind of symptoms. So, menorrhagia, dysmenorrhea colicky in nature, dyspareunia, frequency of urination, and hypogastric mass. So, in case of complete repertory, it has been given as female genitalia menorrhagia. We're just taking the symptom of menorrhagia in this. So, menorrhagia, again, in case of Borix repertory, go to the female sexual system, we find menorrhagia, profuse premature flow, remedies in general. Again, under that, there is a subrubric of protracted premature profuse. Then, in Borix repertory, again, we have dysmenorrhea remedies in general. There is no direct rubric for adenomyosis. Like in endometriosis, we had endometriosis. We had for pelvic inflammatory disease, we had pelvic inflammatory disease. But for Adenomyosis, we do not have a direct rubric. We have to completely rely on the symptoms which they give. So Kent, we have genitalia female, menses painful dysmenorrhea, Clark, dysmenia or dysmenorrhea, Patek's repertory again, painful dysmenorrhea, again, complete repertory again, we have dysmenorrhea. These are the representation of dysmenorrhea in different repertories. Then we have abdomen swelling, hypogastric region. Then we know that adenomyosis is there can be a swelling, there can be a growth. So complete repertory, go to abdomen, tumors, hypogastrium. Again, complete repertory, go back to the female genital chapter. There is hemorrhage, uterine metrorrhagia, urination, frequent urging. Only one remedy is there, that is Steiner. And the most common remedies are again Sabina, Thalaspi, Ustilago, Trillium. Now, talking about Sabina, again, we know that it has a heavy, bright blood flow. Very copious menstrual flow will be there with heavy clots. And the menses also last for a longer duration with colicky pain. The menstrual cycle pattern in case of Sabina is to last for a longer duration. That is what we talk about as menorrhagia, right? And Thalaspi bursa, for prolonged menstrual bleeding, this prolonged nature is nearly around 10 to 15 days. Profuse bleeding with clots, uterine colic during menstruation, then marked exhaustion will be there, which attends excessive bleeding. So, weakness is a particular symptom in case of Thalaspi. Ustilago for heavy, dark menstrual flow and the dark in color. Sometimes they'll be in a long, black, stringy, and then clots will be there. And these clots will pass with a dark blood. They are usually dark in color again. Blood may have an offensive odor in case of Ustilago. Trillium for bleeding between the periods, and menstrual flow appears at around every 2 weeks duration. They will be menstrual pattern. That is trillium. So calcarea carb, if you talk, we know that there are lot many symptoms in calcarea carb which can be thought of for a female complaint. But in this, we talk about is for early, profuse, and prolonged periods. Pain and cutting nature will be there, and it usually appears in the uterus during the time of periods. That is, cutting nature appears in the uterus. The nausea with pain will be there during menstrual cycle. That is calcarea carb. Pollution, we all know better by bending double. We have always been reading it right from the first year, I guess. So for severe cramps during periods, pain tends to get worse after eating or drinking. Then relief by bending double. This is the keynote of Kulosynth. Then abdomen pain by distension. And the two which will be having a sensation of distress along with the uterine colic. That is one particular symptom of Kulosynth. McFirst, talk about the pain. There will be a cramping in nature, drawing, darting, shooting, or like a lightning kind of pain, as if we can say a cutting in nature. That kind of pains will be there in McFirst. And bruised sensation will be there in abdomen. In Viburnum we usually give Viburnum to manage the uterine pain that is radiating to the thighs. The uterine pain radiating down the thighs again. The pelvic region feels full and congested in case of Viburnum. Also, whenever there is a pain in the back or the back pain, there will be all nausea along with it. Lastly, we have sepia, and that too we know that sepia, I guess in every condition which I have told, sepia was definitely there. So sepia is an all-rounder actually, with painful intercourse, tendency of early and copious periods, and bearing down pains will be there in the pelvis and small of the back. So this was about adenomyosis. Asherman syndrome. The other term for Asherman syndrome is usually the uterine synechiae. Now, whenever there is a post-abortal curettage, or we can say there is a DNC, dilatation and curettage, after that there will be a hypersensitive reaction. And because of that, what will happen? There is a adhesion formation. And when we do a hysterosalpingography, what we can see is a honeycomb-like appearance. That's what we see in Asherman syndrome. So what in case of Asherman syndrome, in case of rubric selection, we have to think about is adhesions. So complete repertory, if we go, generalities, we get adhesion internal. Clark's repertory, we have clinical chapter in which we can I think I'm audible.
Yeah. Now it's so audible. Okay.
Okay, done. Thank you. Yeah, we were talking about Asherman syndrome.
Yeah.
In case of Asherman syndrome, we spoke about the chapter in clinical chapter, that is from class repertory additions. Now remember, in class repertory additions, there is only one particular remedy which is given, and that is thiocyanamide. I guess thiocyanamide was even told last class. So clinical repertory additions, thiocyanamide. So we have women Fartak's repertory additions after surgical operations, which goes very well along with the Asherman syndrome. Asherman syndrome, we have already said, dilatation and curettage. Afterwards, we get addition formation. So this particular rubric is very essential for Asherman syndrome, that is Fartak's repertory, operation surgical after additions. Nurse repertory, if you go, we get tissues, inflammation, additions, recent, consequent upon inflammations. Then Kent's repertory, if you go, we can find a rubric called abdomen, addition, sensation. Only one remedy is there again, sepia. And synthesis, generals, additions. We do not have a particular organ which has been given. It is given generalized one, but we can pick it up according to our need. So the symptoms we have. Now what we can do is we can think about few remedies. The one of the most important remedy, I've already said thiocyanamide, which is given. Now it is given in the Metri Medica that whenever thiocyanamide is given, it usually acts as a solvent externally and internally. And basically it dissolves the scar tissues, it dissolves the tumors and enlarged glands and adhesions. So we have adhesions here. So it means if we are giving a patient who is coming with Asherman syndrome with adhesions, if we give thiocyanamide, it will definitely work as a solvent. Now, silicea and even medurinum has a symptom of lysis of adhesions. So we can talk about, we can even think about the medurinum and silicea. The next one is a very important again, fibroid uterus. Talking about fibroid uterus is very important, right? The studies actually say that fibroid can alter the shape of the uterus as such and the cervix even, and it will impact the movement of the sperm. That is how it is related to the infertility. We know that we have read the entire theory part of fibroid. Talking about infertility, this is how the patient can come up with infertility if a patient is having fibroid uterus. That is changing the shape of the uterus and cervix, and this will impact the movement of the sperm. And also, the fibroids, we know that if it is becoming big in nature, they block the blood flow to the uterus, making it harder for the embryos to implant on the uterine wall. And if there is no much place for the embryos to implant, the successful implantation will not be taking place. And some fibroids are formed in such a way that it blocks the fallopian tubes, preventing fertilization of embryo from reaching the uterus. So this is how it is related to the infertility. Now, talking about the repertories, the first one is Kent's repertory. In Kent's repertory, we have menses, bright red, clotted, copious, dark in nature, offensive. We have frequent, protracted. Now, basically, these are everything which is related to the fibroid uterus. Then pain, bearing down uterus. If the growth is, little too much, little bigger than enough, we'll be having bearing down pain. So the patient will come with bearing down pains. That time we can take this particular symptom. Then we have tumor, uterine fibroid as such. Then metrorrhagia, fibroid from. Then genitalia, female, tumors, uterus, fibroid. Metrorrhagia, fibroid from. Oh, sorry, I've mentioned it twice. Then generalities, tumor, fibroid. So, there are all these kind of representations. Again, when you go to synthesis repertory, same kind of rubrics have been given. So, one more. Menses, painful will be there. Fibroid from. Myoma in uterus from hard and large. That is a particular rubric which you can find in synthesis 9.1. Then tumors, uterus, myoma, accompanied by pain, large one, hard, whether it's a painful or not. These are the sub-classification. We can say sub-rubrics, which are given in the synthesis 9.1. Then talking about nurse repertory, there are little more classifications. You can see tumors, fibroid, bearing down pains, which you already said, enlargement, hardness, stony hardness. Fibroid causing hemorrhages or fibroid with a tendency to hemorrhage. You can see there are two different remedies. Tumor fibroid hemorrhage causes, that is hydrastis. Tumor fibroid hemorrhage with tendency to calica, a little different one. Then interstitial fibroids, we already know the classification, submucous and all that, right? Interstitial tumors are there. So leukorrhea with profuse mucoequivalent excoriating, that is under tumors fibroid. Again, the sub-rubric is leukorrhea with profuse mucoequivalent excoriating discharge. Then, if it is a fibroid on the os, we have vitiligo. We have polypy with menorrhagia, subserous fibroids. So the typhoid fibroids with the remedy is being given in nurse repertory. Uterus enlarged low down as if os open to admit finger, smooth body felt within. Something like that of an examination part. It's given in nurse repertory. Then hemorrhage predisposition to from fibroid uterus or fibroid tumors, subinvolution, enlargement and hypertrophy is given in nurse repertory. And menses dark of clots, mostly liquid, varies from half a pound to 2 to 3 pounds in 24 hours. Now, what I meant to say is that there are variety of symptoms in nurse repertory which we actually do not give a look into. It is a very important repertory. Murphy's repertory, who direct rubrics are there. That is disease female, go to, disease and the female chapter both will be having fibroid uterus. And under the fibroid uterus, there are again sub-rubrics like bleeding from hard stony. In both the chapters, that is diseases and female, the symptoms are same, the rubrics are same as well as the remedies are same. And apart from this, under the female chapter, tumors, uterus, there are only 3 remedies for that. That is aureum neonatum and silesia and terebinthrin. Boric repertory, we have, generalities, tumor, fibroid, again with hemorrhage. If you go to chapter female sexual organs, we have tumors, fibroid, polypi, myofibromata. The same way, uterus with bleeding remedies with fibroids or due to fibroids. That has been given in as a 3rd rubric. Then generalities, tumors, fibroid from. These are the representations of fibroid in case of Boris repertory. Now, complete repertory, again, in this we can see the 3rd rubric. You can see the generalities, pain, fibroid tissue, the ligaments. So this is one particular rubric which is a little different from the others. Apart from that, others are same. Pathak's repertory, again you go, you will find fibroma or myoma, fibroid tissue ligament, fibroids, we can see hard stony, the menstruation pattern with copious, profuse, excessive, clots with large clots with, all these are. Again, everything is one and the same. Even the Clark's repertory also gives fibroma with hemorrhage. Now, there is a key point which we can think. If at all it is a menorrhagia, we can differentiate whether it is an intramural or submucous or subserous or endometrial one. Now, in case of intramural and submucous, usually they come up with a menorrhagia. And in these are the representations of menorrhagia from different repertories. Complete repertory, we go to menorrhagia. Porix repertory also we have menorrhagia. Basically, the difference between all these menorrhagia rubrics and different repertories are the addition of new remedies will be a little different. The remedies which you find in Boric will be there in the complete repertory. But what will happen is there'll be addition of different other remedies also will be there in the complete repertory. So basically, it keeps on updating every time. That's what happens. That's what becomes the difference in the different repertories. Now, metrorrhagia, submucous, and endometrial one. Again, these are the representations of metrorrhagia in case of complete repertory, Kent's, Borix, and Clark. Clark, you can directly go to the clinical chapter and find out metrorrhagia. For other things, you have to go to female sexual system or female genitalia, then go to the hemorrhage, uterine metrorrhagia, or directly visible in metrorrhagia. The common remedies, usually there are many remedies actually for fibroid uterus. I've just taken the few which are available in the rubrics which I have shown. So first one is class B, the fibroid with prolonged menstrual pattern. Menses continue for 10 to 15 days. Menstrual cycle is profuse with the presence of large clots, and violent uterine colic will be there during the time of menstrual cycle, and cramping pain the uterus during menstruation. That's what we can think about as thalassemia. Calcarea carb, it has been given usually for heavy periods from uterine fibroids. Uterine fibroids with heavy periods. And menses, they continue for long and may even appear early. That was happens in case of calcarea carb. Apart from the menstrual cycle, menstrual symptoms, the vertigo during menstruals will be there, and leukorrhea of thick, milky, or yellow color. That is what is in calcarea carb. Talking about belladonna, the fibroid with painful menstruation. That is what we give it for belladonna. That too, a cramping kind of pain will be there in the uterus during the time of menses. And the menses are usually bright red in color, and they are profuse in nature. Sepia can be given when there is a gripping or burning or bearing down kind of pain during menses. And the menses, they start early and they are quite profuse, or we can say quite copious in nature. And again, when there is this particular symptoms of fibroid uterus in case of sepia, there'll be fainting and chilliness during menses. And painful sexual intercourse in uterine fibroid. That is what it is indicated for. Ustilago, again, Ustilago is given for uterine fibroid with dark menstrual bleeding. And whenever there is a dark menstrual bleeding in Ustilago, clots will be there, heavy clots. Uterine bleeding may be even stringy in nature. When talking about Sabina, when uterine fibroid definitely will be there, along with that, clots will be there which pass during the menstrual pattern. And slightest motion increases the menstrual bleeding. It's a particular symptom in case of Sabina. Pain from sacrum to pubis that we have already seen. So this is about Sabina. Then we have trillium. See, trillium, we have fibroid with back pain during menses, pain radiating from the hips to the back during menses. And remember, there is a symptom, tight binding of the back and the hips will provide relief. That is a tight binding of the back and the hips will provide relief in case of trillium. Bleeding, usually it is a bright red in color, and there'll be gushing kind of bleeding. And trillium is usually given for intermenstrual bleeding every 2 weeks. Calicarb, it is for fibroid uterus with back pain during menses. And the back pain usually isn't violent in nature. Pain gets better from sitting and pressure. And the menstrual flow in case of calicarb is very profuse. Erigeron is one important bleeding remedy. And for frequent urination with fibroid uterus, you can think about erigeron. Painful urination, excessive menstrual bleeding with bright red in color again. And again, intermenstrual bleeding, we can think about erigeron, but from slightest motion or slightest exertion. China, again, is a particular remedy for fibroid uterus, wherein heavy bleeding will be there with anemia, profuse dark menstrual bleeding, clots will be present with exhaustion and anemia. And there'll be, every now and then, there'll be fainting spells in the patient. Ferromet is included in, include pale or watery, heavy and prolonged menses, leading to anemia. That time we can think about is Ferromet. Then menstrual flow worsens from the slight movement, lower back pain or abdomen pain during menses. That is what is a symptom of Ferromet. Talking about calcarea floor. Calcarea floor restore the lost elasticity of the smooth muscles, and usually they remove the hard tumors of any kind of smooth muscle. So it has that affinity towards a smooth muscle, and if calcarea carb is being given in uterine fibroid, they remove the hard tumors. And in case of calcarea floor, what will happen is the uterine fibroid will be stony hardness will be there, and usually they are indurated swellings in the uterine regions, and a lot of bearing down pains will be there in calcarea floor. Talking about phosphorus, phosphorus, they have usually been given to long, slender females having uterine fibroid, and that too stitching pains will be there in the uterine region, and the menstrual pattern is early or scanty and long-lasting menstruation. Then comes the Apis mellifica. Talking about Apis mellifica, usually it is given for uterine fibroid with suppressed sexual desire, or we can say even uterine fibroid with jealousy and with local symptoms of marked tendency over uterine region. Then painful menstruation with stinging, burning pains. Conium, think about when there is a fibroid uterus with suppression of unsatisfied sexual desire, or from excessive indulgence, or from effects of some sort of injury. That time we can think about conium. And also there'll be dysmenorrhea, and the pain will be in the thighs. And then we have medorenum. Medorenum can be given in case of hypertrophy and fibroids, and we'll be having clotted and dark, offensive, profuse menstruation. And the stains which are there, which are very difficult to wash out, and urinates frequently during menstruation. The other remedies apart from these are, we can even think about buforana. Buforana can be given in cases of menorrhagia and metrorrhagia, any of these. And accordingly, we need to give the patient. And even carcinosin. Carcinosin, we already know that there is a complication of fibroid uterus, that is, it can turn sarcomatous. But that time, if a patient is having a cancerous predisposition in the family or family history of the patient, that time we can think about carcinosin in uterine fibroids. So that was about uterine fibroid. The next one is chronic endometritis. Now talking about
Salini, ma'am.
Yeah.
You can skip the drugs which you have already explained. Okay.
Okay, done. Thank you.
Okay.
So chronic endometritis. Talking about chronic endometritis, it's a condition actually which involves the breakdown of the peaceful coexistence between the microorganism and that too of the host immune system, that too in the endometrium. Now, a majority of chronic endometritis cases they do not produce any signs and symptoms as such. Now, when we talk about chronic endometritis, that too with the infertility, we have repeated implantation failure that occurs in case of chronic endometritis, and because of that, even there is a recurrent miscarriage, and this is a particular area of worry when we talk about chronic endometritis and infertility. Now, what will happen is when a patient comes up with chronic endometritis or a pathological process, the inflammation which occurs, they can actually lead to the alteration of the endometrial cytokine production. And this will damage the endometrial function. And if this occurs, there will be abnormal patterns of lymphocyte in the endometrium. Now, if this is again there, the receptivity of the endometrium towards this embryo and implantation, all this process will be altered. That is how infertility usually occurs. Now, talking about endometritis, in the Bode's repertory, we'll go to the female sexual system, uterus, inflammation, and in that you will find endometritis, metritis. Chronic we have acute. We have even under that we have peri or even parametritis. If at all this comes with hemorrhagic cases, we have the symptoms. So we have the rubrics. If it comes with chronic venous congestion with, if it comes with chronic arterial congestion with, these are the representations of endometritis in case of Bode's repertory. Next, coming into nurse repertory, female sexual organs, uterus, inflammation, metritis. Again, even we can go back and see in the rubric congestion and sensitive. So endometritis, that is hydrastis, is one particular remedy which is being given. Then talk about nurse repertory, uterus inflammation, endometritis, chronic sweat, and that sweat will be fetid in nature. Then in axilla and on the feet with burning of the soles. That is lycopodium is one single remedy which is given. Under complete repertory, again, inflammation, uterus, metritis, endometrium, that is endometritis. Then dropsy, uterus, endometritis. And so all kinds of endometritis symptoms you can, rubrics you can fetch from these repertories. Coming for Clark, we have clinical chapter, go to endometritis, you can find the rubric. In case of synthesis, go to the chapter female genitalia, inflammation, uterus, endometritis. Only one particular symptom is, remedy is there, that is belladonna. The common remedies as such, viscum album. Now, talking about viscum album, in chronic endometritis, hemorrhage will be there with pain and blood, partly clotted and bright red in nature. The pain again from the sacrum into the pelvis, tearing kind of pain, shooting pains from the above downwards. Another remedy, hemamelis, uterine hemorrhage, which has been given for a lot of uterine hemorrhage cases. Now, in this, they will be midway between the menstrual cycle, there will be soreness in the abdomen. Or we can say intermenstrual pain will be there. In case of phosphorus, specifically given for metritis. And slight hemorrhage from the uterus between the time of periods will be there. The leukorrhea which occurs are profuse, they are smarting or corrosive instead of menses. Kilcor, I think we have already seen. Allos, uterus feels heavy, cannot walk much on that account. Murex, feeling as if something was pressing on the sore spot in the pelvis, and that's why they'll be worse sitting in nature. And then sore pain in the uterus, dysmenorrhea with the chronic endometritis is one particular symptom you can find in the Metri Medica, and that too with displacements. Must keep legs tightly crossed. These are the symptoms of murex. Belladonna, pain in the sacrum, that is cutting pain from the hip to hip, or badly smelling hemorrhages, and hot gushes of the blood. William tick can be thought of for endometritis, wherein acrid brown leukorrhea will be there, or blotted feeling in the uterine region. Hydrastis, again, acrid, corroding, shredding, tenacious leukorrhea. These are the things which we can think about for endometritis. Now, we have chronic cervicitis. Talking about chronic cervicitis, we all know that there will be a long-standing, if at all there is a long-standing chronic cervicitis, they cause infertility by affecting the nearby organs as such. Now, and it may lead to chronic cervicitis, may lead to endometritis, it may lead to cervical endometriosis. Then again, it may lead to acute or chronic PID. It may lead even to tubal blockage, then hydrosalpinx, and even more deeper infections like urinary diseases and all that. So once there is a chronic cervicitis, these are the next conditions which can get lined up. Accordingly, we know that chronic cervicitis, if at all a patient comes up, they will be having symptoms like excessive viscous or purulent discharge, then discharge which are glary material like that of a white of an egg, then backache or lower abdomen pain. These are the few symptoms. Now, accordingly, we'll choose the repertory. Under nurse repertory, we have female sexual organs, uterus, redness, cervix off. Now, we know the signs of inflammation, the rubor, calor, and all that. So, accordingly, we can say take redness, cervix off. Now, female sexual organs, uterus, swollen, cervix bleeds when touched. We know that in case of cervicitis, on doing an examination, it will bleed on touch. So, that's what the symptom is. Again, we have cervix, uterus congestion, cervix off, or leukorrhea purulent. That's a symptomatological representation of cervicitis. Under Kent's repertory, you can take for genitalia female, pain, burning, uterus, cervix. The same way, swelling, uterus, cervix, leukorrhea, purulent again. It's one and the same things. Complete repertory, inflammation, chronic, uterus, cervix. Again, inflammation, uterus, metritis, cervix, membrane lining. That is inflammation in the lining membrane of the cervix. Inflammation, purulent cervix. Inflammation, chronic uterus, cervix. These are the different representations which we can see in the complete repertory. In the Borix repertory, it is clearly mentioned female sexual system, uterus, cervix, inflammation. Under the bracket, we have endocervicitis, which is a very important rubric. This rubric, apart from the other rubrics which are given in the different repertories, this is very important compared to the others. Murphy's repertory, diseases, cervicitis, uterine, cervix, which bleeds easily, excoriation width. When we're talking about excoriation width, it's more of a cervical atropine or cervical erosion. Next one we have under the chapter female, cervicitis, inflammation, cervix, bleeding easily. The remedies are actually the same. Synthesis repertory, like in Borix repertory, we had endocervicitis. In case of synthesis repertory also, we have endocervicitis. And under endocervicitis, as a sub rubric, we have chronic. So we have chronic endocervicitis, or we can, in short, we can say chronic cervicitis in synthesis repertory. This is taken from synthesis 9.1. So the common remedies, we have natramure, creosotum. We're talking about creosotum. Cervicitis with offensive and itchy vaginal discharge is creosotum. But whereas cervicitis for thick white vaginal discharge, it is natramute. But if it is thick yellow vaginal discharge, it is hydrastis. Alumina we talk about is for cervicitis for vaginal discharge with extreme burning in the vagina, genitals. Then argentum nitricum for vaginal bleeding following the intercourse. Nitric acid is a very important remedy for offensive vaginal discharge. Merck salt talk about for cervicitis with frequent urination. Cantharis again for painful or burning urination we can think about as cervicitis. Apart from that, there are many other remedies like lilium twig we can think about, R salve, belladonna, or calcarea fos, again hydrastis, ustilago, and china. These are the few remedies which we can think about for cervicitis. For hydrastis, there is one more thing which we can talk. We already saw here, there was a condition for excoriation with. In case of hydrastis, we have a particular symptom that is erosion and excoriation of the cervix with leukorrhea, acrid, corroding, shredding, and tenacious. This is a particular symptom which we can find. So if at all a patient comes up with a symptom like this, we can directly think about as hydrastis. Lastly, we have vaginitis. Talking about vaginitis, we know that it's inflammation of the vagina, and that too results in the discharge, which is very profuse and offensive in discharge. And the discharge is usually greenish or yellowish or salty in nature. And plus, there will be irritation and itching within and around the introitus. Dysuria and frequency of micturition is an important symptom in case of vaginitis. Accordingly, in Kent's repertory, either we go and search for the symptoms, that is leukorrhea offensive, leukorrhea yellow, or leukorrhea green in nature, that is subrubric. Then leukorrhea copious, genitalia itching vagina, or bladder urination dysuria. So these are the correct, direct representations of the symptoms of vaginitis. Now talking about complete repertory, we have particular rubrics, that is female genitalia, inflammation, vagina, vaginitis. Again, vaginitis, coition during. Vaginitis in the night time. Vaginitis, fright aggravation. Then inflammation, vagina, vaginitis, hymen of lacerated after the coition. So these are the representations of vaginitis in case of complete repertory. Under boric repertory, again, you will get directly vaginitis, which is acute and the chronic one. Next one is class repertory. Again, direct rubric. Under the chapter clinical repertory, you can go and search in vaginitis. Nurse repertory, again, we have n number of rubrics again. Female sexual system, coition, sexual organ, coition, aversion, vaginitis in, leukorrhea, vagina, vaginitis in, menses brown, dirty in vaginitis, then menses retarded, vaginitis in. Like these are the different symptoms that a patient can come up with. And during urination, burning, vaginitis in. During urination, females irritation of the and tenderness of the extreme lower part of the vagina, and that too in vaginitis. These are the things which are given under NER. In Murphy, again, you can see either you can go to the chapter disease or you can go to the chapter female. Under the chapter disease, vaginitis is there, and under the chapter female, we have lot many subrubrics like burning, discharge with. Here you can see there are, this is very important, the Murphy's repertory. You can see vaginitis infection from Candida albicans. Even you can see here, it is written trichomonas. So these things are only given in Murphy's repertory. So vaginitis, burning discharge with, we have from Candida albicans, we have chronic, we have excoriation, we have gonorrhea infection, itching of vagina with, sex during, swollen vagina with, and trichomonas. And we can see the different remedies which are given in Murphy's repertory with it. In synthesis repertory, there is only one different rubric, that is new sexual relationship sins. This is a little different from the other repertories. Apart from that, everything is the one and the same. So synthesis repertory, female genitalia or sex, go to vagina, vaginitis. Under that, the sub rubric will be new sexual relationship sins. The common remedies for vaginitis are pulsatilla. Now in pulsatilla, vaginitis, that will be with white, yellow, or greenish bland vaginal discharge, and that with vaginal soreness will be there. Creosotum, we already know. Borax, burning vaginal discharge, which is in the color of egg white. And vaginitis occurs midway between the menstrual cycle. That is an important thing of borax. Vaginitis occurs midway between the menstrual period. Then we have graphitis. Graphitis, again, we have thin or white acrid discharge with backache and increased discharge in the morning while walking. In this, we have a particular remedy, curare. And remember, in this, leucorrhea, it is thick, purulent, and offensive in nature. Mercurius, leucorrhea, excoriating, and it is greenish or bloody, with a sensation of rawness in the parts will be there in mercurius. Calcarea carb, it will be having a thick yellow or milky discharge, and that it will tend to cause an intense itching. And usually we know that the person of calcarea carb is usually towards overweight. So this is about the vaginitis. Thus, a little of causative factors of infertility is covered. Now we'll go to the symptoms related to infertility. We'll see some direct rubrics. Now in Fartak's repertory, you can go to the chapter female and search sterility. In lot many repertories, if it is just in the chapter generalities, if sterility is being given, we can take it leaving the fact whether it's a male or a female. Right? It can be taken generally. Now, in case of Fartak and Kent and synthesis, we have it under the female genitalia. So female sterility, female genitalia sterility again, female genitalia sterility. In case of synthesis, we have sub rubrics are also there. Sterility, leucorrhea with, or sterility, menses, copious menstrual flow from, or too early menstruation with sterility, or too late menstruation, or too scanty menstruation, or sterility from suppressed menstruation. So these are the sub rubrics in under synthesis repertory. Under Murphy's repertory, go to the chapter disease, you will find again infertility, and female, again infertility. These two infertility rubrics are one and the same. And apart from that, under the chapter female, the sub rubrics of infertility are atrophy of the breast and ovaries. If at all infertility accompanies with the atrophy of the breast and ovaries, we can think about iodine, which is the only remedy which is given in Murphy's repertory. Then, if it is from ovarian atony, then if it is from profuse menstrual flow with infertility with vaginal discharge, these are the representations of infertility in Murphy's repertory. Then complete repertory, go to chapter female, we have sterility, leucorrhea with, and uterine torpor. Torpor means something which doesn't have a physical activity, inactivity of in the physical level. That is uterine torpor from. We have gossypium, one remedy. Then synoptically, if we search, we have sexual impulse. In that, we have sterility as such. Again, clinical repertory, we have Clark's repertory. That is the sterility, the rubric is there in the clinical repertory. Oryx repertory, we go to the chapter female sexual system. It is not exactly given as infertility, conception difficult. And in the bracket, we find it as sterility. And the remedies are veratamure, borax, conium, graphitis, iodum, medorinum, nacromure, and platina, and so on. Now, these were few representations of infertility in the physical level. Now, we come into the mind, depression, sadness, infertility from. These are a little more indifferent. Then dysmenorrhea, painful menses, infertility in. So in these, infertility or sterility is not the prominent rubric. It is given under another rubric. All the other symptoms, other rubrics which we saw, was under the rubric infertility. But these we can find, these are the other descriptions. If you go to the chapter female, we find dysmenorrhea, painful menses. Under that, infertility in will be there. So female menses, general, frequent, too early, too soon, infertility in. Then female menses, general, late, too late, or infertility in. These are the other categorizations of infertility under different other rubrics. So there is a particular rubric, that is female infertility, non-retention of semen from, and that is natrum carb. So infertility, ovarian atony from, eupatorium. Now these were the few rubrics which we can see in relation to the female infertility. Now we all know that just knowing the causes and the respective rubrics are not enough for a homeopathic practitioner. It is very important to know even the mind-related symptoms. So, as it is a case of female infertility, we'll deal with a few of the symptoms, few of the mind symptoms which are related to the menstrual pattern. Now, under the chapter genitalia female, we can see menses, copious mania with, or uh, menses anger brings on the flow, or we can say after the excitement, menses will be copious, or excitement from menses will return. Then female who is having a menstrual pattern which is very profuse in nature or copious in nature with nymphomania. Then genitalia, menses suppressed from chagrin, then suppressed due to emotion or suppressed due to grief, or even we can say suppressed because of disappointment of love. So these are the few, mind symptoms related to menstrual patterns. Then we have even vexation after menses. Then if you go to the female sexual organs, menses after weakness, exhausted body and mind altogether. Okay. Then we have, that is from nurse repertory. Then we have under nurse repertory other symptoms like menses frequent or premature one, cardialgia or enteralgia with. That is in nervous, sensitive women with irregular menses, spinal irritation, and disordered hysterical mind. Only one remedy is there, and that is cocculus. This symptom we can find it under nurse repertory. So under nurse repertory, mind and disposition, we can see anger, menses causes suppression of, or anguish or agony, menses appeared until, chagrin, menses suppression, or company aversion to, menses during. These are the other few rubrics. Apart from that, we can see company aversion to or weeping inclination to, which does her no good. And because of that, if the lady is having suppressed menses, there is a remedy, cyclamen. Then mind disposition, crime committed as if she had committed a crime with remorse after menstruation. Then emotion, menses, sudden cessation of, ill humor before the menses or ill humor during menstruation, loquacious during menstruation, or loquacious in young girls during menstruation. So these are the representation of menses and the mind symptoms. Lastly, we have two more rubrics, that is mind, dreams, frightful or nightmare, menses before. And we have again fear, death of, menses after, Sikil Kaur. Now, if you want to know basically single remedies, we have to go back and refer to nurse repertory more, because they give the symptoms as what the patient tells. So this was about the repertory part, but I do want to tell you all that just knowing one particular repertory is actually not enough. We know there is something called cross repertorization and all that. So what I hope that this particular class session which we have taken can help you in sorting out the different rubrics which you want. I mean, if I get the rubric which is there in, if suppose the mental symptoms is the patient comes up with, I find everything in synthesis or may say it in the Ken's repertory. But when we go to the characteristic particulars or something, which we can find it or sort it out in Murphy's repertory or Minturn therapeutics or in a complete repertory, there is always a point which we can do is cross repertorization. That is how it can help. So I hope whatever is being taken today helps you in finding the correct remedy and thus helping it out. Thank you.
Thank you, Dr. Shalini. It
Yeah.
was a very nice presentation. So we also, if there is any doubts regarding any of the topics covered, please put it in the box. We will have a short doubt clearance session. After that, we have a special guest, Dr. Bindujo. She's doing her CFLTC duty. Joining after that. So kindly, if there is any doubts, please put it in the chat box.
Lecithin is usually given in the lowest potency. It has been given that lecithin usually they give it in the 3x potencies. Yeah. No, corticotropinum, basically we know that, right? ACTH producing hormones. So basically, it is the recent ones. I couldn't find it much in the Metria Medica as such, but I have read a few research studies which they have done. So in that, it has been given that if at all corticotropinum has been given, it works nicely. I couldn't find many research works, but one or two research only. But there were no I couldn't find the material in the Metria Medica. Yeah, you know what? If you the question which Dr. Shashi has asked, if you find a particular pathology which is there, and if a patient comes with any particular kind of clinical condition, there is no problem in taking all the rubrics, maybe physical or mental or pathological rubric. But the one which we need to do is we usually often we take all the simple and the general symptoms. It is already I don't know much, but ML Dhavli has written a book, and in that he has written that if we find out the core of the patient, it is more than important. Now it has ailments from it has been divided into different levels. If at all we are able to take those particular derive those particular symptoms from the patient, it will be more than enough. And along with that, if you are adding the pathological rubric, that means it's again cutting short, and you will get a perfect remedy for it. Yeah, I am really sorry, Dr. Smija. I couldn't find much of hyperprolactinemia. We have to go back and go for the symptoms of it. Amenorrhea after fever. You want to know the remedy? 1 second, I'll be telling you right now. Okay, before that, I would like to say that differentiate a patient having vaginismus or dyspareunia. Now, vaginismus is basically psychogenical, right? And dyspareunia, you can say that it is mostly correlated, we can say. Vaginismus is basically a pathology, we can say, and dyspareunia is basically a reflection of it. I'm really sorry, I couldn't find a rubric of endometrial hyperplasia as such. Obstinate amenorrhea, Thuja, is very important remedy which we can give. Yeah, I think that is over.
Yeah, Dr. Shah. Yeah. Dr. Nidisha, are you there?
Yes, Dr. Deepu.
Just give ma'am
Yes.
a vote of thanks. Okay, after that, we will go to that another session. Okay.
Okay. I would like to thank Dr. Salini Mandal for this wonderful session. It was a lot more informative, Doctor, for the rubrics and all those remedies that you have explained. Thanks a lot for this wonderful session, ma'am.
Thank you.
Thank you. Okay. Now I'd like to introduce a special guest to you all, Dr. Bindu John, ma'am. Dr. Bindu John Pulparambil graduated from Government Homeopathic Medical College, Trivandrum, Kerala. She has MD in Organon of Medicine from Government Homeopathic Medical College, Trivandrum. She is the gold medalist in BHMS, University of Kerala, India of the year 2001. She is the recipient of Prakash Memorial Gold Medal for being topper among the 3 universities in Kerala in 2001. Ma'am has presented an international paper on acute myeloid leukemia and its homeopathic management, Bucharest, in the year 2016. Above all, she is the student of Professor George Vitolkos since 2006 at the International Academy of Classical Homeopathy, Alonissos, Greece. I would also like to use this opportunity to thank Dr. Bintu ma'am for finding time to impart a bit of her vast knowledge to us. I wholeheartedly welcome you to this session, ma'am.
Thank you so much. Firstly, I would like to apologize for 2 reasons. One, I'm in COVID CFLTC duty, so I don't have a PowerPoint. The second is I have to switch off the video because the reception here is very,